Yeah, hi, I'm Dr. Shilpa from Bangalore. So today we will be discussing about heart diseases in pregnancy. So heart disease in pregnancy is one of the complications during pregnancy which we come across, and this is classified as high risk pregnancy. So heart disease could be classified majorly into either congenital heart disease where the woman has been born with the heart disease, or it could be commonest in India being like rheumatic fever. So this is again because of a infection, and there will be some changes in the valves of the heart, and this can affect the woman. So coming to the congenital heart disease or even the rheumatic fever, the steps remain the same. So we assess the severity of the heart disease depending on NYHA classification. So in this classification, we see as to how much compromise the woman is having because of the heart disease in terms of her activities. So if the woman is finding it difficult to even walk or even to do her routine work, and she has breathlessness and all that, then it is definitely a severe form of the disease. If the woman doesn't have any problems, like if she can walk, run, jog, and do all these strenuous activities even without having any changes in her heart rate or pulse rate or her respiratory rate, then we usually term it as very mild heart disease. So before she plans for a pregnancy, we usually take the fitness from the cardiologist saying that her heart condition is good enough for her to plan the pregnancy. So this is very important because there will be so many changes during pregnancy that the heart will be overburdened with the blood flow or pumping the blood. So the heart will have to work a lot during pregnancy. So this may again change the dynamics in the heart functioning, and it may cause problems during pregnancy, even during delivery, if it is not properly detected and if it is not properly managed. So throughout pregnancy, we would like to involve a cardiologist when we are dealing with the heart disease. And during pregnancy, usually congenital heart disease, that is, if the woman is born with a heart disease, then the chances that the baby will also have a heart disease will be about 10%. So we get an additional scan called the fetal echo, where we do an echo of the fetus to check if the baby has any congenital problems. And during pregnancy, we monitor the patient's hemoglobin, patient's blood pressure, patient's cardiac functioning and all that at regular intervals to make sure that she is in the best of the health. Also, because of some severe heart diseases, the growth of the baby may also be affected because enough oxygen doesn't go to the baby, enough nutrition doesn't go to the baby because the mother's heart is not pumping enough blood, and enough oxygen also will not be there. So during delivery, so we take the opinion of the cardiologist to check whether her heart is strong enough for her to go through the normal delivery, or whether we should go ahead with a elective or a planned cesarean section. If at all, if it is a planned cesarean section, or even if it is for a normal delivery, we usually do it in a tertiary center where there is a cardiology unit with an ICU for the mother in case if there is any complication, if at all, if anything happens. Post-delivery, she can feed the baby without any problems, and many of the changes which happens during the pregnancy will come back to normal post-delivery, and we suggest her to be under supervision with the cardiologist even post-delivery so that we don't have any complications, because the stress during feeding and immediately after birth will be quite high because she will not get enough rest, she will not get enough sleep, and she will not be able to manage how she used to manage before pregnancy because of the responsibility of the baby. So in all this, I think it is extremely important that the heart diseases are managed with a team of a gynecologist and a cardiologist, the intensive care unit, and a good infrastructure in the hospital which can deal with problems if at all, if there is any. And also if there is a blood bank available, then that would be good. So apart from this, I think we give them, if at all, if there is a heart disease, we give them blood thinning agents, or we don't give them, we avoid blood thinning agents depending on the cardiologist's advice. So this is about the heart diseases, and if you have any more queries on it, please message in the comment box and I will try to answer that. Thank you very much.